Thalassemia. Thalassemia trait, thalassemia minor, is a name for a group of inherited condition that affects a substance in the blood called hemoglobin. Yeah. So thalassemia minor, actually, they may not have any symptom at all. They may have gone for a routine checkup and they may have a slight low hemoglobin. That is it. But if you ask me symptoms of thalassemia minor, they will not have any symptom at all. They are asymptomatic. Okay. But okay, sometimes maybe tiredness. Why? Because of low hemoglobin, as we said. But it's not that low, borderline low, something that you can see. So all the anemia symptoms that you can have here. Obviously, anemia, so we have to look for cancer, maybe it's postmenopausal bleeding, infection, all these can be the reason of anemia. All right. So some medicines can be the reason. So you can mention about these things as well and say it's SSRIs. Psychosocial history is very, 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 very important. Now, it is very difficult. It's not that how to make the diagnosis. So, first of all, I want you to take family history. So, family history is going to be very, very important here. Don't miss the family history if you're dealing with a case of thalassemia minor. Right. So, what we have to do here, you will check a full blood count. You will do like a proper iron profile here. You'll check the MCV and all. And here, if MCV is low, it is microcytic anemia, but you'll check the iron. Iron is normal. Because if it is microcytic anemia, what comes in our mind? Our mind will say it is iron deficiency anemia. Iron is normal, then what it is? So it could be thalassemia. But if the patient is 40 years, 30 years, thalassemia major, no, it is not going to be. Because thalassemia major, the patient won't survive for that long. It could be thalassemia trait, thalassemia minor. Because microcytic anemia, it is iron deficiency anemia. It could be thalassemia. It could be sideroblastic anemia as well. It could be lead poisoning as well. So these are the main things that you will see in microcytic anemia, right? So what we have to do, is, so in terms of treatment, there is nothing that you have to do. There is nothing that you have. It's just tell the patient about few things. I mean, what they have to do is screening the partners. If they plan to have kids in the future, they have to be very careful, because if a person has got thalassemia minor, they are a carrier of thalassemia minor. I mean, so, and if they marry with somebody, or if they have a baby with somebody who's also thalassemia minor, so they have got 20%, 25% of chances having a child who is having thalassemia major. Two thalassemia trait, thalassemia minor. Have a baby, 25% of chances the patient might have thalassemia major. So we have to be very careful, right? Thalassemia major, I mean blood transfusion, iron chelation. But as I said, thalassemia minor, they don't need any treatment at all. They need a bit of counseling. That is the main thing, right? So safety netting, you can definitely give follow-up. Definitely you have to mention how long it's going to take to get better. There is no symptom at all, actually. Is it serious? No. Thalassemia minor, nothing serious. Is it going to create any problem to my kids? So this counseling, definitely you have to do. Right. So that is the main thing that you have to do in thalassemia trait, thalassemia minor. All right.